Hello, fellow endocrine surgery fellowship coordinators and program directors. It's Dave Hughes on behalf of the fellowship committee. I just wanted to create this video to explain the endocrine surgery EPAs at the fellow level and some logistics about how the new platform is going to work. So as we discussed before at some of the committee meetings, the AAS Council elected to initiate EPAs for the fellows this year. And there's a couple different reasons for this. The main purpose of this is to provide fellows frequent feedback about their evaluation and management of common endocrine surgery disorders. Many other programs have elected to adopt EPAs. Fellowships, including the surgical oncology fellowships, vascular surgery, are coming online soon, and we're following suit. These are the core endocrine surgery EPAs for the fellows. There's the pre, intraoperative, and postoperative phases of care. On the first six, you'll have EPAs for management of a thyroid nodule or differentiated thyroid cancer, management of a patient with benign thyroid disease, patients with persistent or recurrent differentiated thyroid cancer, initial presentation for all types of hyperparathyroidism, primary, secondary, and tertiary, management of a patient with persistent or recurrent hyperparathyroidism, or they've had prior parathyroid surgery, and evaluation management of a patient with a functional or incidental adrenal mass. So the three phases of care could be preoperative, where they see the patient in clinic, intraoperative, where they perform a procedure on the patient, and postoperative if they care for the patient after surgery. There are some that just have a single phase of care, which includes patients with inherited endocrinopathies, doing ultrasound for a patient with most likely a thyroid or parathyroid disease, participating in multidisciplinary tumor board, and then some type of scholarly effort related to endocrine surgery. This could be a book chapter, um, uh, publication, anything. There's a few elective endocrine surgery EPAs. These are for the slightly less common disease states, which includes advanced thyroid malignancy, medullary poorly differentiated or anaplastic thyroid cancer, patients with adrenal malignancy or metastasis to the adrenal, patients with neuroendocrine tumors. These are the gastric or pancreatic neuroendocrine tumors, and then a pediatric patient with endocrine surgical disease. So those are the EPAs. Um, the AAS is contracted with Firefly, which is a software program that's supplying EPAs for vascular surgery and some other specialties as well. So the Firefly has two options. You can use the web page or desktop application, which is over here on the left-hand side, and there is a mobile application you can download on your phone. They both have very, very similar functionality. So the Firefly application, once you get your login and have downloaded the application, or you go to the web page, it's very simple to create an EPA for your fellow if you choose to initiate the EPAs. Your faculty can go through the same process as well. So on the home page here, you just click create an EPA. The EPA assessment will pop up either on your phone or your desktop. Your name will be included there. Your trainees will be automatically loaded into the Firefly app. So you'll see your particular fellow there. You can select the date that you did the procedure. You can call this a thyroid lobectomy or any other type of brief description. The endocrine surgery will be the specialty that'll be pre-selected for you. And then you just have to pick the EPA type. This could be, management of benign thyroid nodule, thyroid cancer, whatever. So for this one, I'll just pick benign thyroid. And then ask you for the case complexity. You determine whether this is a straightforward, a moderate, or complex case. This is purely your judgment on it. And then you can pick the phase of care. So for this particular case, I just did a procedure with my fellow. We did a thyroid lobectomy. So this would just be the intraoperative phase of care. In order to see the anchors for this, you can click details, and it gives you all the different attributes that the fellow would have if they had limited participation, direct supervision, indirect supervision, practice ready, or could teach others. So you can use this to figure out which entrustment level you want to provide. I'll just select this, and then you can provide some feedback to the fellow. Make particular comments about how they did that particular thyroid lobectomy. You hit the submit button. They'll take you back to the home page, and then the fellow will receive a notification, both through their Firefly application that they have an evaluation that's been completed for them. They'll also get an email to say that you've or when your faculty have completed an EPA for them. You as a program director can see your prior assessments that you've done. Faculty will also be able to see this. So there's a list of all the different EPAs um, that your fellow has created, or you as a faculty has created. There's some analytics as well. As a program director or the program coordinator, you can go through these analytics and see how many assessments your fellow has had. And then you can also look at the different EPA types that your fellow has created. So that's the applications. It's pretty straightforward. It's very similar to the way EPAs are collected for our general surgery residents, just a different platform. So the expectation that we're going to ask the fellows to do is try to do 3 to 5 of these per week, if possible. We're just shooting for some progressive engagement this academic year with programs. The AAS is providing subscriptions for all the programs this year, so they're covering the cost for this academic year. So logistically, the AAS, Lauren or Gina will send out personal login information to you as the program director, your coordinator, and your faculty. I just need to identify which faculty those were, and they'll also send it out to all the current fellows. It'll talk about how to download the application and then the login to get onto the Firefly program. So I hope this is straightforward. If anyone has any questions, feel free to reach out to me at any time. Bernessa Lindemann has also offered to have some office hours. So Lauren or Gina from AAS will be sending out information about that shortly. Thank you all very much.